if people are willing to, and what I try and do is kind of bring all of that insight and knowledge into what I'm doing on a day-to-day basis with my work. But it makes me a better leader. It makes me stronger. It reminds me connected to people. And at the end of the day, everything that we experience, we're all humans. And that connection with people is just full of momentum and power, whether you're in the home or in a business or wherever. It's a core part of how I think about leading and innovating and parenting.
Hey there, and welcome to the Tribe of Leaders podcast. I'm your host, Emmy Kirshner. I'm a serial entrepreneur, investor, and business coach for ambitious women who are boldly taking their business to the next level. And I believe that building a successful business isn't about working 24/7 just to merely meet a revenue goal. What it does take is a unique blend of dedication to purpose, courageous action, and frequently sheer will to overcome the odds that lead to meaningful impact and experiencing a life well lived. In each episode, you'll get to know the women and men who are unafraid to put it all on the line as they share the stories of success and failure that have made them incredible leaders and the magic they gift the world with. As you're listening, and I hope finding value, don't forget to share the Tribe of Leaders podcast with all of your other entrepreneurial friends and to follow us wherever you're listening to this podcast. Hey, Tribe. I hope that you enjoy this episode as much as I did in recording and talking to my guest, Estelle Giraud. I knew from the very beginning when I read her bio that I was going to love the conversation because Estelle, like me, believes that people don't fit into neat little boxes. And in part of her bio, she talks about having some of the most interesting insights about people in the world come from unplanned intersections. And that just aligns with me so much. And I love her journey because Estelle is a PhD scientist in population genetics who became an entrepreneur, like so many of us, in that it was almost by accident and her own frustration as she was trying to get pregnant and then became pregnant, where she was frustrated by having to keep notes on her phone, essentially, of all of the different doctors she was seeing and her medical records, because there was no one place that could safely house everything. And her business, Trellis Health, now does that, starting with women who are pregnant, and then she hopes to expand to everybody else. But if you've moved around like a lot like I have, or you have multiple health issues, what she's creating is so incredible and so simplifying because it's really difficult to get access to your medical records and to create and really paint that whole holistic picture of all of the different treatments or procedures, medications that you've had in the last maybe year, but maybe it's even a decade. So enjoy this one as much as I did. Hey, Estelle, welcome to the Tribe of Leaders podcast. I have been looking forward to our conversation all day because I am totally in love with your business. And totally in love with your business. And partly it's because I've had so many bad experiences. So with that, please introduce yourself and share with everybody who you are and what you do.
Yeah, absolutely. And thank you so much. I'm really looking forward to this conversation as well. So I'm Estelle Giraud, CEO and co-founder of Trellis Health. And by way of a really quick background, so I am a trained scientist. I have a PhD in population genetics and then spent the early part of my career really deep in academia. I then switched gears and worked in commercial in a large biotech for the better part of 8 years. And really worked at the forefront of medicine in that role and built a 400 million business around population genetics. So worked with customers like 23andMe, some of the biggest healthcare networks throughout the country on a research and then also on a precision medicine initiative. And the idea was, how do we make medicine of the future more personalized and predictive and really focus on the individual at the center of that? But I saw time and time again kind of how challenging that was on so many different levels. And in parallel to that, at the same time, I was going through my own experience into motherhood And it wasn't easy at all.
No.
I'm an IVF mum, proud IVF mum, but even within the pregnancy journey itself, there was just so much kind of unknown and responsibility that you take, and the learning curve is just insane. And so I ended up leaving my corporate job and devoting myself to building Trellis Health. And it really exists at the intersection of these two ideas. So as a starting place, we're starting with, see, can we use a person's personal health data to really provide a supportive layer for her moving through that kind of health journey of pregnancy and starting a family. But our long vision is really that this is relevant for everybody. You know, can we be owners and advocates and really see our own health data in a really effortless way, and then use that to enrich our lives and just live healthier lives in a really seamless way.
Mm-hmm. So can you give an example of how, like, Trellis Health helps you see your health data more effectively and more holistically?
Yeah. So at the end of the day, we call it a health hub. You and everybody, I'm saying everybody, a vast, vast majority of us have our health data in multiple places.
Mm-hmm.
So we might have seen multiple doctors through our lives, especially if we've moved states or moved practices. We see specialists. We have vaccinations done at different places. You know, even the average healthy person has their data scattered and spread all over the place. And so it's really difficult to get a holistic picture of all of that health history. And you layer on top of that, you know, more like the additional tools that we have available today, things like wearables, you know, fitness trackers, genetic testing data, you know, all of this data is critical health information. Today, it's literally spread all over the place. And so Trellis Health, with our software, we have APIs and, you know, a number of things built in the back end that mean that we can collect all of that data for you, organize it, and then populate it in an in-app experience for people to really kind of like see all of that data in one place. And so there's no, you know, remembering passwords. You don't have to remember which doctor you saw 2 decades ago. You don't have to make phone calls to anybody or kind of get anybody to approve anything. It all happens in app within our app, and like I say, organizes that data for you. One thing I will say is, you know, health data in this space is going to be enormous over the coming decades. And kind of everybody from Apple, you know, Apple has Apple Health. There are a number of kind of really big players in space and kind of thinking about health data. But I firmly believe that data is not enough, right? Like, it's a starting place. It's the table stakes for a person to be able to see that data. But in order for that to impact their life in a positive way, we need to kind of interpret that into really practical ways that they can improve their day-to-day. And so a really concrete example with pregnancy, and this example comes from my own personal experience, right? So I had prenatal hypertension, and this affects 20+% of pregnancies. I was having to measure my blood pressure multiple times a day. And I actually ended up having postpartum preeclampsia and ended up back in the hospital. But throughout this entire journey, you know, a lot of factors in kind of day-to-day management. And so with Trellis Health, what I envision, what we're building towards is the software will be able to read from your data that you have this diagnosis, so prenatal hypertension, pre-program in all the reminders and kind of everything that you need to do in your calendar to manage that condition, and then push you notifications to input the measurements, and it all goes into a dashboard and a summary, so that next time you have your doctor's appointment, you've got this kind of like one pager, like ready to go, ready to talk about the most crucial things for your health, and a summary of everything that's kind of happened up until that point from the last visit. And so really it's enabling just easier management for the patient between visits, and also a better relationship with their doctor, because it allows the doctor to operate kind of at the top of their license and the patient to really advocate for themselves. And so that you can improve that kind of care relationship and really get down to it. When I was pregnant and struggling with this, I had all the measurements in an Apple Note in my phone, and I would be there in my doctor's office scrolling through the note, trying to, think, is the blood pressure increasing? Is this thing I should be worried about when the doctor is saying, how is your blood pressure this week? Which is a really simple question, but the patient's not easily empowered to kind of answer the question.
Wow. I love this because for a couple of reasons. One, like I've moved around a lot and even like I had a hard time finding a primary care physician at one point. I think I saw 3 different docs and I never moved any of the records. So I saw them like twice and then and not for anything significant, but still I moved on. And I mean, my records are all across the country at this point.
Like a lot of people, this is, and this problem, sorry to interrupt, but this problem is getting worse because Gen Z, we are mobile, people want to live these free lifestyles where they're not necessarily tied down. And so we're seeing a rise of these, what we call transactional health services, where they may not even have a PCP. They may just go to whatever doctor at the fastest appointment to meet the needs and then just move on.
Right. Well, and I've done that too, where I've been to like different urgent care places within the same like company, but I still have to tell them that I'm allergic to Cipro every single time.
Right.
But I think the other side for me is like my mom's experiencing a lot of health issues. She has a gajillion doctors that she sees, and some of the illnesses are related and some are non-related, but nobody talks to each other. And there's nobody managing her care outside of my dad, who is doing a great job, but there's a lot, and her medication changes all the time.
Yep.
And I know from health coaching, sometimes the docs don't check all the interactions with prescribing stuff that without intentionally meaning it, but that could be interacting with something else that somebody's taking.
Yeah. Yeah. I mean, all of these problems are really at the core of what we're building at Trellis Health. And these are deep, like big problems in our healthcare system. And it's like you say, it's very difficult to say that somebody in a care team is responsible for you and for checking all of this if it's not yourself. And at the end of the day, we are responsible for ourselves. Like I say, you are the most exceptional and expensive thing you own. It's you. And we're not empowered to really easily do that. It's the burden of care, and it typically falls on loved ones or carers that are helping people kind of manage this process. But if we can alleviate some of that and really empower patients with software and with their own personal health information and kind of build that structure underneath them, we can help address some of these gaps in care and help coordinate that care between different providers.
Yeah, I'm so excited. So excited. Like, I really appreciate your experience moving through pregnancy and having all of these things happen, because that's hard.
It is. And really it's hard. I was already, like I say, I was already really passionate about this space and kind of improving medicine and improving human health before I was pregnant. And my journey into pregnancy, like I mentioned, was, an IVF journey. And I went into that incredibly naive, and it ended up taking me and, my husband as well, 3 years of kind of going through the cycles and the injections and the calendars and, all of the management associated with that. And then I was pregnant and I was like, oh, okay, great. I can step off this wheel of, taking such responsibility, and now I fall in the normal case. And I was still shocked by that experience and the amount of work and responsibility and kind of burden that I had for managing my own health through pregnancy. And only 10% of these have zero complications, kind of no issues through pregnancy. But the experience was so jarring. I was like, what? This is not what I signed up for. I'm used to this kind of really digital experience. And my care team was great. I have to say, the doctors were great, but there's just still so many gaps. And so, the realization, the insight was just that this is a perfect place to start. It is such an underserved need in our community. Women are often referred to as chief medical officers of the household because they tend to, and especially now, I think a lot of women are sandwiched between taking care of their children and then taking care of their parents at the same time. You've got this care sandwich, but at least around pregnancy, you've got women taking a chief role within family, and that translates into the community as a medical decision maker for the family. And they also make more than 80% of consumer buying decisions. Like, women are powerhouses of this space, and they've been underserved in their health needs for so long. And so, that's our starting place for Trellis. And I mean, I will say as well, like, this is something that I am unapologetic about as a founder and as a mother. My story and my history and my health journey as a mother impacts who I am as a founder and how I think about this business, and vice versa. So, that journey that I went through is kind of inseparable. And I'm a huge advocate for people not trying to hide those aspects and those challenges of their personal journey and their personal life. We all have things going on. And I think if people are willing to, and what I try and do is kind of bring all of that insight and knowledge into what I'm doing on a day-to-day basis with my work, but it makes me a better leader. It makes me stronger. It reminds me connected to people. And at the end of the day, everything that we experience, we're all humans. And that connection with people is just full of momentum and power, whether you're in the home or in a business or wherever. It's a core part of how I think about leading and innovating and parenting.
Yeah. I mean, my kids are out of the house now, and I started my business when they were little as a single mom, and my parenting has informed my leadership because of everything that we've been through and the way I parented. And it's been really cool to see all of that kind of come full circle as my business has grown and expanded, that these two human beings who are rather opinionated at times.
I think that's a good thing.
It's a great thing. Sometimes not at the time, but they also were very different people. So it's not like I could be like, all right, this worked for Brian, so now I can apply that to Matthew.
Yeah.
It's like
it's an exercise in people management.
Yeah.
And growth.
Yeah. It's never ever going to work for both of them. And then how do I have them interact and really support each other too? So there's so much team building among so many other things. But I'm curious, how has being a parent affected how you've grown your business?
Yeah. And so it's hard to say, okay, this one is like a lesson from being a mother and it's applicable to being a founder, and then vice versa, because I think a lot of them kind of sit somewhere in the middle and flow between them. But one thing that I've definitely learned and taken upon myself over the last several years is this idea of being comfortable with being uncomfortable. So just being really comfortable in situations of being stretched and things not being in control of everything. And that's from my health. And also through the pregnancy, I used to wake up every morning and just in physical, I had really, really bad morning sickness through most of it. And then just the physical pain of stretching. And it was just physically feeling that uncomfortable first thing when you wake up, and there's nothing that you can do about it. And so you just have to mentally be like, okay, well, there's nothing today that's going to make me feel more uncomfortable than this. And it's also, another one of those is doing injections, the IVF injections every morning. Wake up, give yourself an enormous needle, really uncomfortable injection. And it's this idea of, I think it's eat the frog first, do something, really hard and difficult first thing in the morning. And then the rest of your day feels easy, or at least you feel like you have the mental strength to really kind of, and the resilience to kind of go after the rest of your day. And so I just got really comfortable in this headspace. And it was all around being pregnant and being a mother and kind of approaching that version of me where I didn't know what I was doing. And it was just a space that I felt, very uncomfortable in. But you get comfortable in it. You're like, well, this is my normal and I'm okay with that. And so as a founder now, I always try and lean into, okay, what's the uncomfortable decision, and am I avoiding that because it's the wrong decision, or am I avoiding that because I'm trying to preserve my comfort? As people, we love our comfort zone. I think a comfort zone is overrated, and it's better to put yourself in an uncomfortable position, which really gives you purpose. And for me, like, being a parent is 100% that. Like, it's not an easy, comfortable place to exist in.
No, it's not, because they don't come with user manuals.
Right.
No, and I think,
right.
I mean, I spent a lot of time thinking about when they were little, my guys were little, like, what's the best thing for them? How do I help them the most? Like, really being thoughtful and intentional. And there's so many things I wish I had done differently, but I did the best with what I had at the time. And we've had that conversation, the boys and I too. But I agree that it's very uncomfortable. And I think you're absolutely 100% in. It does inform you in building your leadership, just step right into that uncomfort zone, because some of it's just building the muscle. Like, all right, this is what I don't like it, doesn't feel good, but it'll get easier as I move through.
Yeah, just being comfortable with it. And the thing is, like, I tie this myself into my mindset, like a growth mindset, because if you are in a situation you don't feel comfortable in that situation, over time, you will start to feel more comfortable. Like, we expand into the space that we create for ourselves.
Right.
And then you're comfortable in that space now. And then you push to a new space and you expand into that. And that is you growing. That's a growth mindset, to just be looking for those places to grow into and to exist into.
Yeah, absolutely. Before we hit record, we were talking about a lovely experience that you had over the weekend. And it made me think of a time when I had many of them, but I had like flown to Orlando from Philly for the day and was planning to come back and be home by like 8:00. And crazy stuff happened, including the plane that was supposed to be taking off right before my plane got struck by lightning at the gate.
Oh my God.
So I got home at like 2:00 in the morning, and it just like set this whole like chain of events of having to reschedule everything. And then my kid's car broke down, and I was like walking out the door to go to a meeting, and the dogs were up on the carpet that had like just come back from the cleaning place. And it can, like, that stuff, you move through it, but it's frustrating at the time, and it's hard to stay positive. So how do you manage all of that, particularly since if you want to share kind of what happened and learning experience?
So my life logistically got blew up on the weekend. We had a major plumbing leak in our apartment, so now we have to move out, and I am solo parenting this week. My husband's in London, so I'm coordinating a business, recording podcasts, moving house, taking care of my little boy, and then all the insurance. And it's just like a lot. I'm a work in progress. Like, I don't want to pretend that I have all of the answers, but this is another lesson from motherhood that I take into, or it kind of works both ways, but I take it into my philosophy as a founder and a leader. And that is this notion of this too will change. Like, everything changes. Nothing is constant. And I used to remember that in the like really, really tough days of early parent, when you're sleep deprived and kind of everything is blowing up. And I was like, this will pass. Like, the world keeps moving. So you can be like, really struggling in a moment, but it will pass. And the same thing for the really high highs in our life is this like gentle reminder of like, this too will pass, cherish it, have gratitude for that, but then like it will move on, and that's okay. And so in the only way that I can approach this, and I think of it in a very like elemental sense, it's like water. it keeps flowing, and you have these roadblocks in your day-to-day life and these things that you feel that are immovable. There is always a path somewhere. And if you can, just like go with the flow is way too cliche for this. And I reject that actually, but it's, I think we can paint things with an overly optimistic brush and like not understand the depth of like challenge that a person can face in these types of situations. And so I don't want to say go with the flow, but I do try and like stop and sit in the moment for a bit and think like, okay, everything will keep moving. And, I just tackle the next thing that's kind of right in front of me, solve that problem, move on to the next one, solve that one, move on to the next one. And it's a linear process. You don't have to get overwhelmed. It's just like water moving through, finding the cracks. It's got a goal. It moves towards that goal. It doesn't kind of change. It just finds the cracks, moves towards the goal, and there is a path through those situations. So you just have the healthiest thing for my mental health is to just stay in the moment, look at the problem right in front of me and solve that. And I do that as a founder a lot as well. It's like, okay, what's the problem right in front of me right now? Solve that, move on.
Mm-hmm. And do you look at whatever problem it is that's in front of you, if you have a multiple options to choose from?
Yeah.
Like, this is the one that I can't, that's either the easiest to fix or this is the most urgent, or how do you kind of process some of that so it does become more linear?
Yeah. Another analogy I'm going to throw out in this one, because it's kind of like a Bible for me as kind of being an entrepreneur, is the movie The Martian. I don't know if you've seen it. Matt Damon surviving on Mars.
Oh, yeah.
Constant imminent threat of death. And it's just like solving one problem after another. And so the way that I structure it in my brain, even intuitively, is what's your North Star goal? And so for a startup founder, for a CEO, typically in these early days, it's just don't die. Just don't die as a company. Just keep not dying. And so that framework like prioritizes all of the other things. Like, what is the one thing that's going to de-risk that North Star objective the most? And then, for example, in my personal life this week, it's like, okay, my family has to have a place to live. Like, my son has to be safe. And so those are the problems. And then you can rank order things beyond that, but it comes down to like, what are your North Star priorities? And then let the problems organize themselves underneath that. And then you just keep moving through them.
Yeah. Yeah. I mean, that's kind of how I operate too. So it's nice to hear I'm not the only one, but it's still a lot, right? So how do you show up, or how do you ask for support? Because like, this is now taking time that you weren't planning on spending.
Yeah.
Right. So, and it's easy to try to just manage everything at the same time, but you have a team of people.
It's hard.
Yeah.
It's not healthy, but like in instances like this, I don't sleep as much or as well as I should for my health. And so there are things that fall off. And I think that's, relevant for everybody. I think where it gets dangerous is if you're constantly sacrificing those things, whether it's exercise or sleep or, going full circle back to health. You are the most exceptional and expensive thing you own. Like, taking care of ourselves and our body and our mental health is just so important.
Absolutely. Absolutely. And how can you show up as your whole self in those
moments?
Because I think there's some vulnerability there, right? Like, not that you don't want to share that, hey, major plumbing leak, but it's like, I've got to juggle priorities now and I need help too.
Yeah, I'm really glad you brought that up. It's also like, it's not super easy all the time, but it is something that I do try and do. And it's like, I wasn't planning to talk about my plumbing leak on this podcast. But, I think we keep things, especially in corporate business, far too sheltered and behind these cages. And there is just power in having, and it affects culture of the team. And so culture is super important to what we're building at Trellis Health as well. One of our cultural tenets is radical transparency. And it's around, health data and what we're building, but it's also around who we are as people and how we interact as a team. And with transparency, with that kind of openness, you can build trust with each other really quickly, because you can build understanding. You can say, okay, I know where you're coming from this week. Like, let me help you out, or here are my expectations. You've reset my expectations on what we're doing. We can now move forward. It builds communication, all of these really positive things that you want in a culture. But the very first step is just that level of transparency where you can feel comfortable to say, you know what, this is me, this is my whole self, strengths, weaknesses, everything. When I'm on fire, you know what that looks like. And when I'm struggling, you know what that looks like. I mean, like on fire in a good way, when I'm firing on all cylinders.
Yeah, I got it.
Yeah. And so it is about being just a little bit vulnerable as leaders and saying, this is what I'm faced with. And it's, I think there's a balance there around like when you show that vulnerability and like what context that is in, so that people don't lose confidence in you and what you're doing. So in some instances, it's like, hey, I've got this thing going on in my life. I'm telling you about it. Here's the challenge we're facing, or here's the challenge I'm facing that I'm like unable to solve this part, but here's the piece over here that's really important that I'm going to focus on with you for the next hour. And like, I'm not distracted, or, here's the existential challenge that we're facing as a business, but here's my plan of like how I'm approaching that. So, I think there is a balance there. I don't want to say there is no kind of cost to vulnerability, but there is a huge benefit, I think, in culture and communication and speed and trust if we are able to bring this to the forefront in the right situations.
Yeah, I'm so glad to hear you say that, because it aligns with what I believe and how I try to operate. And I think there's a value in the acknowledgement of, hey, I'm having an experience and it's messy right now. And even if there's a moment of potentially falling apart or not, I think just acknowledging that you're having a struggle gives other people perspective.
100%.
And I agree, there's a balance too, because you don't want to be over sharing or over whatever, because I think that does affect the confidence. But I think having to go through something and people not knowing makes it very difficult for them to support us in general.
And they will, particularly as you rise higher and higher, I think, up leadership, like people want to see you as a person. And, I think about female role models. There aren't as many female role models in the highest levels of power globally, whether that's, politics or business or whatever that is. But I really gravitate towards the female leaders that are unapologetic about who they are and what they bring to the roles that they bring, even if that looks a little bit different. And so, like, when I was pregnant, I was constantly searching for a female role model in business who was pregnant and kind of did those two things at the same time. And I love Jacinta Ardern, who's the Prime Minister of New Zealand. And she was the first female Prime Minister of New Zealand. She was pregnant in office, and she was like, I'm the first female prime minister and leader of a country, pregnant in office, unapologetic about it. I'm going to take 3 months leave. My cabinet and my team will take care of things, and I trust them to do that. I'm going to go be a mother for 3 months and then come back. And she just made that normal.
That's amazing. That's the way it should be, because your team should be able to manage stuff for time, like an extended period of time. If everybody's moving fluidly and you're setting them up for success, that's what should be happening.
Yeah.
Brilliant leadership.
Yeah. So I think, I mean, I love seeing leadership like that kind of like unapologetic leading with heart and as a whole person.
Yeah, absolutely. I want to shift gears a little bit back to health. Who is Trellis Health for? Like, who can sign up or use Trellis Health?
So right now we are in private beta, and private beta is just for pregnant women within the US. So if any of your listeners are pregnant or know anybody that is pregnant and they want to try out the service and kind of get access to this, we would definitely welcome them. There's a sign-up sheet on our website. But I do want to reiterate that our broader goal here is to serve not just the pregnancy health journey, but kind of everybody that's faced with managing their health at one point or another in their life, and even preventatively. So we really see this going into a child health record and a family health record, and then, individuals like anybody. But right now we're starting with pregnancy.
Awesome. And we'll have the links in the show notes too for your website and for the beta version too. So
fantastic.
If you're pregnant and want to try it out, go to the show notes. And for you, do you have a sense of the time frame of when you'll be able to include other groups or other individuals?
Yeah.
Will you give us
That's on the surface, that sounds simple. I mean, this comes back down to how quickly can we innovate and bring new solutions in healthcare. Healthcare is one of the trickiest markets to kind of innovate in and build new solutions for a number of reasons. And so I don't want to segue too far into this, but I'm a firm believer that you as a person have a right to your health information, and it's your information. It impacts your body and your life and your journey. It should be yours, and you should have free and easy access to that. Historically, that hasn't always been the case within the system. The kind of US healthcare system has been, has made that really, really difficult for patients to do. And so that is changing. And we are continuing to kind of innovate in that space and enable that as fast as we possibly can. But there's just complexity in the US healthcare system.
Yeah, I understand. Believe me. Well, I look forward to following you and staying in touch. And I want to thank you so much for coming on the podcast today, because I'm really I'm just so excited about the work you're doing.
Thank you. And I'm really glad we got to touch on so many different things today, but I really enjoyed the conversations. So thanks.
Awesome. Thank you. Thank you so much for being a listener of the Tribe of Leaders podcast. I am so grateful for each and every episode that you tune in and listen to. And I hope that you get a ton of value that you can implement starting today. I do have just a quick favor. If you wouldn't mind hopping on to wherever it is that you listen to podcasts and leave us a rating and review, it would help us tremendously so that the Tribe of Leaders podcast can be found more easily and help inspire other entrepreneurial leaders.